UC Davis Comprehensive Cancer Center. Thanks for joining us today as we have in-depth discussions of the science, research, and advancements taking place at our National Cancer Institute designated Comprehensive Cancer Center. I'm Chris Joyce.
And I'm Stephanie Wynn. We'll also talk about cancer prevention and, most importantly, how we are breaking barriers to beat cancer in our community and beyond. Today, we introduce you to child life specialist Jenny Belke, Marissa Martinez, and Mackenzie Lee. Hello, ladies. Good to have you.
Hello.
These specialists work directly with pediatric patients and their families to provide a positive environment for our children as they go through cancer treatment and also to help their parents get through it all. Let's start with you, Marissa. What is a typical day like for you?
So a typical day for a child life specialist in the Cancer Center starts with us collecting our census when we arrive. We typically try to take some time to do chart reviews so we know what specific patient needs are for that day. And right when we're done with that, we get to go to morning report with our infusion room nurses. And in that report, we get to go over all of those individualized needs, advocate for our patients in that space. And at 8:30, our day starts. Our patients start arriving all the way to about 4:30, our last patients arrive. So throughout the day, we are providing procedure support, a lot of different services throughout the day, just depending on patient needs. But we wear many different hats here. So our day, sometimes we'll plan for it and it'll look completely different once it starts rolling. So we're pretty flexible with what gets thrown at us during the day.
I bet. So when you say procedure support, what does that mean? Does that mean holding their hands or entertaining them while they're getting a procedure?
Yes, so we are very procedure heavy here in the infusion room. So procedures look like IV starts or port accesses are very common for our kids here in the infusion room. So procedure support for a child life specialist includes procedure preparation. So we will be checking in with the patient and the family to see what works best to help them cope through that procedure. And that might include education for why that procedure is happening, what it entails, and then creating a coping plan to help them through that procedure in the most positive and successful way possible. So that might include pain management. That might be called distraction or diversion rather than entertainment, just to kind of help divert their attention somewhere else if watching the procedure is something that they might not want to do. And then a lot of procedure support also includes post-procedure check-ins, planning to see what can be different for the next time, or we'll keep the same plan if it worked great.
What are your backgrounds? Are you nurses? Are you counselors? Are you a little bit of everything? And what are some of the techniques that really work with these young kids?
So to answer the question about our background, so we're certified child life specialists, and essentially we're experts in child development, stress and coping, and play theory. A bachelor's degree is required for our career, but many of us, including the three of us, have graduate degrees as well. So that's kind of what our background is. And then your second piece to that was what works well for our kids. Is that what you said?
Yeah. What are some of the techniques that you feel work with? I imagine every child is different, but what are some of the techniques you use as you help these kids get through procedures and treatment?
So the biggest thing we start out with is assessment. Every child's different, every family's different. So we try to meet a child where they're at, what they understand, what they need to succeed during their appointment and during their procedure. And from there, we can age appropriately educate them and prepare them for what their appointment's going to entail, whether that is a poke or a dressing change, or just normalizing the environment for them while they're here at the Cancer Center. So that's the biggest part of where we start out to see kind of where that goes from there. But it all goes back to preparing and educating kids. A lot of studies show how beneficial that is for children's success in their medical experiences and meeting them in an age-appropriate, developmentally appropriate way using the right language. Language is so powerful for what we do, and we're experts in being able to assess that and use the right tools for each kid.
Well, I know that part of the support that you provide are coping strategies. So can you tell us about, maybe give us an example or a scenario type of thing of what that might look like for a patient?
So when it comes to coping, there's a few pieces we look at in the infusion room to support coping as a whole, because it's not just, one one system for everybody. So again, as I mentioned before, we meet kids where they're at. So the first part of that is preparation and education for their appointment. And then once they understand why they're there, what the procedure is, we go into a coping plan for that procedure. So that can look like, and this part is pretty cool for kids because this is the part they get to control. So much control is taken from them when they come into the infusion room because things are happening to them that they don't have any choice in. They need these medicines and these treatment plans to get better, and they don't have a voice in that. So being able to provide that back to them is really powerful. And so in that coping plan, they get to choose things like a comfort position, a comfort hold, if they want to sit with, which provider they or caregiver they want to sit with, how that comfort hold looks as long as it's safe for their body. We kind of help with that choice as well. And then whether they want to count before their poke, a 1, 2, 3, if they want to know what's happening, if they don't, do they want to watch? Do they want to look away? If they want to look away, do they want to watch a show? Do they want to play a game on the iPad? Is having something in their hands helpful, like holding a caregiver's hand or holding a stress ball or a fidget item? And once we kind of make that coping plan, then we're able to relay it also to the nurse and make that a team effort as well to execute that plan as successfully as we can. And then during the procedure is another layer of a coping strategy. So sometimes kids don't realize they're holding their breath when it's time for a poke, like an IV. So sometimes we have to, in the moment, express you're holding your breath. That's making your veins smaller. So take that big, deep breath like you're blowing out a bubble or blowing out a candle. It'll help open your veins, calm your body. It's also going to help your nurse be successful at their job. So kind of giving them that power back again, but teaching a coping strategy at the same time. Also trying to do positive self-talk for our kids that get really anxious and nervous. You can do this. You are strong. You are brave. You've done this before. Whatever that may look like, we try to instill those strategies as well in them during their procedures, focusing on their fidget item or what other diversionary activity we might be doing with them. And so that's in the moment. And then you add on another layer post-procedure. So that's when we can also start expanding these skills further and introducing more tools. Because a lot of the time, coping strategies aren't successful if you're doing it in the middle of the stress, the thing that's causing that stress and causing that anxiety. So we want to practice that outside in a calming environment and where the patient's also feeling calm, and we can expand on those skills.
And some of those main things look like deep breathing exercises. So it's really easy to tell a kiddo, breathe, relax, but sometimes we need to dive a little bit deeper and give them further instruction. And so really helping practice deep breathing. There's box breathing, so just different types of breathing to help you either calm and relax your body. There's even breathing to help bring more energy to your body. So whatever works for that patient, practice is going to be what's most helpful. We also have techniques like guided imagery and guided meditation. And these can really work well for those older school age kids and adolescents because their brains are more developed. And so we can focus on guided imagery, which focuses more on 5 senses. So thinking about what something looks like, what you might hear, smell, taste, and kind of use your imagination in that way to divert attention. Or guided meditation that's more focused on what you're feeling and your body. So something like a body scan. And that's really helpful for our kids who do experience a lot of negative stimulation, like needle-related procedures. Tape removal is a big stressor. So we want to encourage positive touch at the same time. So whether that's massage on the opposite arm, or just that natural body scan of noticing, okay, what is your body feeling in this moment? So we can do those guided imageries and guided meditations, but we also promote a lot of free accessible apps to our patients and families that they can have some guided practice outside of the hospital setting as well. And it's about creating a toolkit. We think of it like a little fanny pack, like which tools are going to, be useful for you today, because here's all the tools that you do have, and you have control on what you can choose to help you in that moment.
I was going to say, jumping off of what Marissa was saying, our goal as Child Life Specialists too is to help them learn those coping styles and to create that toolkit so that they don't always need Child Life to be present. And so we're all really excited when they're like, we don't need you anymore, we got this. But really focusing on building that up so that they can be successful and feel like, yeah, I've mastered this.
Outstanding. Well, then following up with the coping plans and the coping strategies, you all have one of the most coveted jobs at the Cancer Center, which is taking care of Huggy, our facility dog. So Would you be able to tell us a little bit about how Huggy works with the patients and some fun things, I guess, maybe that you get to do to make everybody's life a little bit easier during these times?
Huggy is definitely one of the most coveted employees out there. Um, Huggy's been amazing. There's so many different things that we can do with him to encourage patients during their treatment and their time with us. Um, he can help provide control to patients when they can't get control in other areas of the medical field. They can tell him no. They can give him commands to have him pull the curtain closed or to pick something up off the floor. He does a lot of cuddling with patients. Um, he can encourage them to ambulate. And so if they need to get up and move, or if the doctor needs to observe a patient walking or moving, I can give them Huggy's leash and say, I'm so tired. Can you take Huggy for a walk? And it gives them something fun to do rather than one more thing that a doctor's telling them they have to do. He also really helps motivate kids to come in. We've had a few instances where a kid didn't want to leave his car. So we had Huggy walk outside and the patient walked Huggy into the building. And another time where a patient was having a really hard time coming in the building, I went out there and said, I can't find Huggy. And he ran inside to help me find him. So he can also help provide motivation in those senses as well.
And what's the best advice you can give parents if they have a child who's about ready to start cancer treatment?
My favorite piece of advice to give patients and their families is to hold on to your boundaries. Because a lot of people see a child is sick and they want to say, it's okay, you don't have to do any of the rules that we've put into place. But when you stop requiring patients to do certain things, when you stop requiring a child to do certain things, it's really hard to come back to that 2-3 years later and say, no, you have to clean up your room, but you haven't been making them do that for the last 3 years. And so I will normally talk with parents towards the beginning of it's okay to give them some leeway.
I want to say the biggest thing, because every child is different, every family's different, beliefs are different, but the biggest thing is to be honest. Kids pick up more than we think they do. They hear more than we think they do. And you don't have to tell them every detail, but being honest about your body is sick, even though you might not feel sick right now, because not every cancer makes a child feel sick physically. And we need to go to the doctor to get some medicine to help you feel better, even if it's that simple. And when we get there, there's going to be child life specialists there that can help you understand more about what's going on with your body. And if there isn't a child life specialist available there, ask your team, ask your nurses, your doctors, tell them that you need answers for your child, you need resources for your child, because the more they know about what's going on with their body, because their body is their own, the better they're going to get through that treatment, even if it's scary. It's terrifying for parents, I can only imagine, but it's also really terrifying for their child when it's happening to their body too. So that would be my biggest advice, is honesty.
Yeah, the other thing that we really promote is parental self-care. No matter the age of the kiddo, the patient will feed off of the parent's energy as well. So being able to be that sound person, that safe person, they meet so many new people, experience so many new scary things. The world is flipped upside down. And so for the parent to be able to hold that safe grounding for that kiddo, that is so vital. And so we do promote a lot of self-care for the parents themselves, and that includes, like Mackenzie says, asking your team for help, asking what questions to help your child. Giving as much resources and guidance as possible helps the parent control their stress level just as much.
How do our patients access your services?
At the beginning of the day, we do patient assignments. And so we will determine, based on timing, who would be able to see that patient at that time. But as she said, we expect to see every patient that's coming through to the infusion room. So parents do not have to request us. However, we love to hear those referrals when we do have new patients arriving, because in the infusion room, we don't just service oncology patients. We get, hematology, we get GI patients. And so there are families coming who are not related to the cancer population who might, already know about child life services. So they can also refer for our service as well.
Okay, so switching gears a little bit. What is your favorite part about being a certified child life specialist at the Cancer Center?
I think for me specifically, there's obviously lots of wonderful things about our job, but the biggest thing is that as we talk so much about coping, like that's our huge thing we're promoting. Coping's not linear, and crying is coping, screaming is coping. Sometimes we have to do those things to get through hard things, and I try to tell our patients that all the time. And experiencing, as a specialist, getting to experience those ups and downs of coping with our patients and seeing them get to that place of mastery, of being able to advocate what their body needs, telling their team, oh, I need this pain management, I need this style of comfort hold, I need this for distraction, and doing it successfully is like the one of the neatest things to be a part of and experience and watch them thrive and actually watch them not need child life support for their procedures. It's cool to watch them progress to have all those tools in their fanny pack like Marissa mentioned and be able to do it on their own. It's pretty powerful to watch. That's one of my favorite things.
Marissa, anything you would add?
For me, my favorite part of being Child Life in the Cancer Center, to kind of go off of Jenny, Mackenzie, Jenny, and I learn so much from each other because we all have our own little specialties of what we do in the Cancer Center, but we also get to work with such a large multidisciplinary team here in the Cancer Center. So that includes our medical assistants, dietitians, infusion room nurses, case coordinators, pharmacy, the doctors, nurse practitioners, our front desk staff. Everybody is so involved in all of the patient care. So being able to have that teamwork and collaboration is also really powerful to have in this setting.
For me, one of my favorite things about being a child life specialist in the Cancer Center is that we're all able to bring in our passions into the Cancer Center and build our own little toolkits of what might be helpful to another patient. So for example, I have Huggy and I get to bring him in. There's Reiki, which Marissa is trained in, infant massage. There's all of these different components that we can bring in if we see a need that is going to change a patient's experience in the Cancer Center. Administration has been above and beyond supportive for those things.
So, how can the community get involved? I think a lot of folks have a soft spot for kids who are getting cancer treatment. Are there opportunities to volunteer or perhaps donate to help support what you're doing?
Yes, so we have an online website, our UC Davis Child Life website, where we have our donor program on there. So we accept donations all year round, either in kind, monetary. We try to navigate our donors to our website, our UC Davis Child Life page. We have our biggest thing, I would say, is our Amazon wish list, because on that Amazon wish list, we're able to break down our donations based on specific programming within our department. And so donors can donate specifically to the facility dog program or our art therapy program, music therapy, or you can break it down and donate to a specific age group. We have an adolescence tab, an infant tab specific to the NICU. So there's, different ways that donors can provide to the hospital. And we do have a lot of community interest in volunteering as well. And so our biggest volunteer program is through UC Davis University. And so the students at UC Davis are able to have volunteer experience or a volunteer internship through the school. And so our volunteer program is mainly based on student volunteers, but we do have a community program where non-student volunteers are able to volunteer at the Cancer Center or in the main hospital. So we go through a volunteer department at UC Davis Health.
You also help to facilitate different events at the Cancer Center, like the annual holiday store. So what are some of your favorites, and what can we look forward to in the future?
So we have what we do. We do special events. The Child Life Department, our program coordinator, handles our special events throughout the hospital. So it includes inpatient, but also the Cancer Center. So we do have, groups like Cosplay for Hope, and they'll come with different princesses. They'll come with different superheroes that will come visit the kids, which is really neat. We did an Elsa and Anna party in the waiting room the other week, where they got to make crafts and play games with Elsa and Anna and listen to music, and the kids loved that. And so those are some things to look forward to. We do those throughout the year. We do giveaways for each holiday, like little, like a stuffy or a stress ball, different things the kids get to pick out. that pertain to that holiday. But one of my favorites is we have the droids come. They're like R2D2 droids that were actually handmade by the people who run them. And they come and they'll dress in like antlers and Christmas lights for the kids, and they sing and they move and they wave their arms up and down and they talk to the kids. So that's one of our favorite visitors that will come.
I think an important thing to note also is that our special events aren't just special events. Our special events help provide kind of opportunities to celebrate holidays and kind of normalization. When you're at school, what are you doing? You get to celebrate those holidays. You get to have dress up for Halloween. You get characters that come around and do your candy. Um, that also goes the same for our holiday workshop that we do. It provides an opportunity for parents to pick out toys for their kids when they couldn't have gone shopping otherwise because they're in the cancer center every day that week. We have a handful of families every year that say they weren't going to celebrate Christmas because they couldn't afford it due to the cancer treatment. The cost of the cost of being in the hospital setting and having to come from far away, gas, co-pays, food while you are away, those things can all impact your ability to continue to have those opportunities. And so the holiday workshop, I think this past year we served over 250 families. We were able to have some volunteers come in to assist with that. Families always get emotional and say, we're really allowed to pick toys from here, or some families decline it saying, no, I can't. But when they hear that this is the way the community wants to give back and wants to show that they care and they support them, it's an amazing feeling to be able to be that middleman to make this happen.
Well, and following on that a little bit too, the UC Davis Child Life and Creative Arts Therapy Department, they recently got a donation from Spirit Halloween that pushed that total donations from Spirit Halloween over $1 million. So how do these types of funds, what do they allow you to achieve for our patients, and how are they utilized, especially at the Cancer Center?
I did just want to mention something that's neat that I don't know that we reviewed with you guys. Since Marissa was our third full-time child life specialist that got to come on to our team, it allowed us to expand how much we get to cover at the Cancer Center, which has been a pretty neat change. So I can let Jenny and Marissa can each talk to what their specialties are, but for me specifically, I got to move more into clinic coverage. And like we do unsedated LPs, lumbar punctures in the clinic, and it allowed me to be able to assess and support all of our oncology patients that are able to do that in the clinic. It's allowed me to take on clinic referrals for kids who get their ports out and have to do peripheral IVs in our phlebotomy lab here at the Cancer Center. It's also allowed me to work with our first bone marrow transplant patient that has started at our new program and prepare and educate them, including the donor, and have that opportunity to just continue to expand into our clinic services since we see so many clinics here in the Cancer Center other than just oncology. So that's been pretty powerful, and I'm sure Marissa and Jenny might also want to talk about what they do as well.
Yes, so Spirit Halloween has been fundamental in being able to make the hospital less scary for children and families, both at the Cancer Center and in the main hospital. So the Spirit Halloween donation funds our UC Davis Child Life Fellowship Program, which provides additional training and supervision to aspiring certified child life specialists. I was one of those fellows that was able to take that opportunity that Spirit gave me, and I can only speak wonderful things of Spirit Halloween to be able to provide me the opportunity to gain confidence and growth as a new professional in such a large hospital. I think it was fundamental to me, being able to come out into the Cancer Center and be an addition out to here. And so the expansion based on the need from the fellowship in our child life department, we have grown in the Children's Surgery Center, in radiology, and in our Cancer Center, resulting in really more children and families being able to receive support and guidance from child life services.
I'm so glad you said something because I was about to say the same thing. The growth in the Cancer Center as far as patients go has really skyrocketed in the last 2 years, allowing us to have 3 full-time child life specialists, and we have an art therapy position. I'm primarily in charge of the pediatric infusion room piece of it, and being able to meet each patient that walks in the door, educating them on their procedures, coming up with coping plans, implementing it, helping them with pill swallowing. That's something that they have to do for 2 years plus. Knowing how to swallow a pill or coming up with other techniques is really important. We also do a lot of normalizing activities, arts and crafts, video games, things that they would be doing at home to help increase that comfort level while they're in the cancer center and to give them things to look forward to while they are with us.
And I'm so grateful being the third person to be added on to this amazing team, because we've been able to have more child life services in radiation oncology. So we're able to assess if patients need anesthesia. Having radiation therapy anywhere from 4 to 6 weeks can be challenging on the body. And so we want the patient and parents and guardians to feel very prepared that they will have a successful, positive experience in a new environment as this added treatment. So being a point person for RadOnc, we've also been able to start a school reentry program here in the Cancer Center. And so school reentry really is for our newer diagnoses to help classmates understand how to best welcome their peer back into the school. We can also do this at the beginning of diagnosis, as well as patients might be transitioning out of school if that is a decision that they make with their medical team. So school reentry is another service that we're able to provide. And as Jenny mentioned before, I'm Reiki certified, which is a non-pharmacological method of relaxation and pain management. So we're able to have that service out here in the Cancer Center now as well.
And do you have anything else that you want to add before we wrap up?
See, I know Marissa mentioned earlier that we wear lots of hats. And so in addition to all of this patient care that we've discussed, I know Marissa mentioned volunteers. We also do a lot of volunteer training. We're in charge of the volunteers that are in the pediatric cancer center areas, donations, special events. We also supervise students that want to become child life specialists, both practicums and interns that may be on the unit and learning how we do what we do. That's one of the greatest things about Child Life too, is that we aren't just doing one thing. There's lots of different things that we get to put our hands in the pot of and find different passions, and it's pretty awesome.
And that really flows into also us giving a shout out to our ever-growing Child Life department. We are able to provide child life services in the main hospital wherever the kids are. Being a level 1 trauma center, the child life specialists provide different types of support depending on the unit and the kiddo. So we have child life specialists in our emergency department, radiology, children's surgery center, our NICU, our PICU, Gen Peds, which also includes adolescents that are on adult units, audiology, the Mind Institute, and children of adult patients. So we service kids across the hospital, and the flow for those units are different. So some might be more heavy on grief and bereavement. Others might be heavy on preparation for procedures and procedure support. And those longer stays, sometimes it's really focusing more on that long-term rehabilitation and coping. So it really depends on where you're at and what that specialty might be. So just wanted to give a shout out to all of our child life peers who are working hard across the health system here at UC Davis.
I'd like to take a moment and thank Canine Companions for Independence for providing facility dogs free of charge to medical organizations that work with people with disabilities and illnesses. They have an amazing group of trainers who spent 2.5 years training Huggy and our other facility dogs to make them the perfect animals to work in our medical environments.
Well, and as somebody who gets to interact with them sometimes, I think they did a phenomenal job at the training, because Huggy, along with the other facility dogs, is just a joy to be around, and to watch him interact with our pediatric patients is so great. He's gentle, loving, happy to see them, and the way that he obeys their commands to give them the control it's wonderful, and it just puts a smile on your face.
It's amazing. They really do pick out the perfect demeanor and behavior and personality for each location. And every dog is so different, but Huggy is the perfect fit for the cancer center.
Job well done by all of you. I'm sure that the parents are eternally grateful, from the support that you've provided, not just their children, but them. And I'm sure the doctors and nurses realize how critically important you are to providing care to our kids at the Cancer Center.
We appreciate you all joining us today, and thank you for tuning in and listening. If you'd like to get in touch with us, you can email us directly at beatcancer@ucdavis.edu. Beat Cancer is a production of the UC Davis Comprehensive Cancer Center. For more information on our NCI-designated Comprehensive Cancer Center, please visit health.ucdavis.edu/cancer.